Welcome back to the channel. Today we're going to explore one of the UK's most horrific true crime cases, the story of Beverly Allitt, the so-called angel of death nurse whose crimes shook the nation. This medical serial killer abused her position of trust, leaving a devastating trail of victims in her wake. But the question is, how was she able to get away with murder when there are clear signs of a mental disorder? In this video, we're going to break down her background, her psychological profile, the devastating crimes she committed, and the legal implications that followed, including how the UK Mental Health Act shaped her sentencing. Beverly Allitt was born on October 4, 1968 in the quiet town of Grantham in the UK. She spent her childhood in the small village of Corby Glen with her parents Richard and Lillian and her two sisters and one brother. On the surface, her upbringing appeared ordinary, but beneath the surface was someone who was deeply troubled. Even as a child, Beverly was known for fabricating illnesses and injuries to gain attention, and she frequently visited doctors and hospitals for conditions she did not have. Her obsession with medical care was so extreme that it reportedly led to the unnecessary removal of her appendix. These early indicators foreshadowed what was yet to unfold. As Beverly entered her teenage years, her behaviour grew even more disturbing. She would often wear unnecessary bandages and cast for fake injuries and would frequently doctor shop, moving from one physician to another once they realised her symptoms were fabricated. Her bizarre behaviour led her into social isolation, making it difficult for her to genuinely form friendships with her peers. As she distanced herself from others, the relationships that she had formed were frequently exhibited as patterns of manipulation and violence. Beverly's former boyfriend described her as aggressive and deceptive, recounting instances where she made false allegations of rape and pregnancy to control their relationship. Despite her troubling behaviour, Beverly pursued a career in healthcare. She undertook a nursing program at Grantham and Stephen Hospital. At the time, the hospital was desperate for staff, and this allowed Beverly to slip through the cracks, despite repeatedly failing her exams and showing poor attendance. She managed to win over her supervisors, portraying herself as a deeply committed to caring for others, a front that effectively concealed her profound psychological struggles. Later, experts and investigators suspected that Beverly Allitt may have been suffering from Munchausen syndrome by proxy, which is now called fictitious disorder imposed on another. This rare but dangerous psychological condition involves a caregiver deliberately fabricating or causing medical emergencies in those under their care so that they can gain attention, sympathy, or control over them. In Allitt's case, her psychological profile later helped to unravel the terrifying pattern of child abuse and the murder she carried out, an outcome that deeply shook the entire UK. Beverly Allitt's terrifying series of crimes took place over just 59 days between February and April 1991 at the Grantham and Stephen Hospital. Her first victim was Lem Taylor, a 7-month-old boy admitted to the children's ward with a chest infection. Initially, Lem was stable, but Len's parents were persuaded by Allitt to briefly leave the hospital. And it was during this absence that Allitt administered a fatal dose of insulin, triggering a sudden cardiac arrest. And despite desperate resuscitation efforts, Lem's condition worsened and tragically he passed away. At the time, no one suspected foul play. Beverly Allitt, as a nurse, had successfully hidden behind the trust of both her colleagues and the grief felt by Lem's family. The second victim was Timothy Hardwick, an 11-year-old boy with cerebral palsy, admitted after experiencing an epileptic seizure on March 5, 1991. While stable on a mission, Timothy suddenly arrested under Allitt's supervision. Emergency interventions failed to revive him, and his death was mistakenly attributed to complications from his epilepsy. However, an autopsy revealed no medical cause for the cardiac arrest, a detail that in hindsight should have immediately raised a red flag with hospital administrators. The next victim was 2-month-old Becky Phillips. She was admitted on April 1, 1991, suffering from gastroenteritis. After appearing to improve, she was discharged, only to die later that night at home. Allitt had secretly administered a lethal dose of insulin during Becky's hospital stay. Because her death occurred outside of the hospital, no suspicions were raised at the time. Tragically, Becky's twin sister, Katie Phillips, would soon become another of Allitt's victims. Katie was admitted shortly after Becky's death and fell seriously ill on 2 occasions after an insulin overdose administered by Allitt. Although she survived, Katie was left with permanent brain damage and partial paralysis. The 5th victim was 15-month-old Claire Peck, who was admitted on April 22, 1991, following a severe asthma attack. She required ventilator support and Allitt was assigned to her care. While on the ventilator, Claire suffered a sudden cardiac arrest after Allitt administered a paralytic drug. After being revived by doctors, she was returned to Allitt's care and tragically suffered a second arrest, and this time it was fatal. Claire's death marked the final fatality before Beverly Allitt's actions finally came under scrutiny. Several children under her care narrowly escaped death, but some did suffer serious harm. Bradley Gibson, a 5-year-old child, was admitted to the hospital in March 1991 due to pneumonia. Initially stable and expected to recover, his condition took a sudden and alarming turn while under Allitt's care. Allitt caused Bradley to suffer a cardiac arrest, which required emergency resuscitation. Following this, she administered insulin, leading to severe hypoglycemia and another critical collapse. Bradley's repeated medical crisis, induced by Allitt's actions, raised concerns but did not immediately expose her as the cause. And although Bradley survived, the trauma he endured was profound. Later, his case became a key part of the evidence that eventually led to Allitt's arrest and conviction. If you love true crime breakdowns like this, hit the subscribe button so you don't miss out on my next deep exploration. Your support helps the channel to grow, to bring more in-depth analysis of cases where medicine and law collide. And this brings me to the next part. How was Beverly Allitt ultimately exposed and apprehended? Well, it was Paul Crampton, a 5-month-old boy admitted with a mild bronchial infection, who ultimately became the key to uncovering Allitt's identity as a silent killer. Though initially stable, Paul endured multiple hypoglycemic episodes caused by nurse Beverly Allitt, who administered 3 separate insulin overdoses, one of which involved nearly the full contents of an adult-sized syringe. And these actions kept Paul in a prolonged cycle of medical crisis and subsequently triggered concerns among senior hospital staff. This discovery, combined with a pattern of unexplained collapses in other young patients, initiated a police investigation that ultimately led to Allitt's arrest. And this raises the question, what drove Allitt to commit such horrific acts against those in her care? Well, the answer lies in a rare psychiatric disorder known as Munchausen syndrome by proxy. Now, Munchausen is considered a form of child abuse because it causes significant physical and emotional harm to children. It involves a caregiver who fabricates and induces illnesses in a dependent to gain attention and sympathy. Today, the term Munchausen's has been replaced by fictitious disorder imposed on self or fictitious disorder imposed on another. Beverly clearly meets the DSM-5 criteria for fictitious disorder imposed on self, given the history that we have just gone over. However, our focus here today will centre on the DSM criteria for fictitious disorder imposed on another. The DSM, or the Diagnostic and Statistical Manual of Mental Disorders, is a comprehensive resource published by the American Psychiatric Association. It provides a standardized criteria and classification for diagnosing mental health disorders. In satisfying the first criterion, the falsification of symptoms, this was satisfied when Allitt engineered medical scenarios to create the illusion of unexplained collapses and emergencies, making it as though her patients were experiencing natural medical crisis. The second part of the first criterion, induction of injury or disease, Allitt deliberately inflicted harm on her patients by administering insulin, causing severe hypoglycemia, or injecting air into the bloodstream, triggering a cardiac arrest. And you might be wondering at this stage, if Beverly Allitt's conviction was based on injecting air into the bloodstream of infants, how does this align with the expert panel's findings in the Lucy Letby case, which concluded that injecting of air is unlikely to cause harm? I think the conclusions reached by the expert medical panel in the Lucy Letby case reflects advancements in medical research and neonatal physiology. All of this has happened since the Allitt trial. Further, the prosecution in the Allitt case relied heavily on other medical evidence, including elevated insulin levels, puncture marks, to connect her to the crimes, which indicates that her conviction is likely secure. I think this highlights how strongly legal decisions are shaped by the evidence and understanding available during the trial period. The last part of the criterion, deceptive behaviour, well, Allitt concealed her harmful actions by presenting herself as a caring and attentive nurse. Her deception helped her to gain the trust of colleagues and the victims' families, allowing her to conceal her malicious actions and to continue harming others unnoticed for a prolonged time. Beverly Allitt fulfilled the second criteria by deliberately presenting her young victims as critically ill or injured to other medical professionals and to their families, and she did this in three specific ways. First, by fabricating illnesses. Allitt caused medical crises like hypoglycemia and cardiac arrest and then disguised them as natural illnesses. She also positioned herself as a caregiver by presenting herself as a dedicated nurse to earn the trust of her colleagues and victims' families, enabling her to remain close to her victims while sustaining the illusion of care and compassion. There was also continuous escalation. Allitt's actions often kept the children hospitalised for longer periods than what they needed, during which she would repeatedly present them as unwell, worsening, or in need of urgent medical attention. As for Criterion C, Allitt's deceptive behaviour was evident even without clear external rewards, such as financial gain or career advancement. Her actions were driven by a psychological need for attention and control rather than tangible benefits. By creating medical emergencies and positioning herself as a heroic caregiver, she satisfied her internal compulsion to be seen as indispensable and caring. This lack of external motivation underscores the deeply rooted psychological nature of her actions. And finally, Criterion D. Beverly Allitt's behaviour cannot be attributed to other mental disorders like a delusional or psychotic disorder. Her actions demonstrate an intention to deceive, and this aligns neatly with fictitious disorder imposed on another. Unlike delusional or psychotic disorders, which often involve a distorted perception of reality or uncontrolled impulses, Allitt's behaviour was calculated and methodical. She acted with full awareness of the harm she was causing, driven by the psychological need for attention and control, and not by delusions or psychoses. As Allitt's physiotherapist noted, who reportedly informed her patient services manager, Allitt was harming herself and thought that she was unfit to be a nurse, another red flag. At sentencing, Beverly Allitt was detained under the UK Mental Health Act 1993, specifically under sections 37 and 41, which allows for hospital orders without restrictions. Section 37 is typically applied when an individual is convicted of a serious crime but is also diagnosed with a mental disorder that requires treatment in a secure hospital rather than incarceration. This ensures that she is not absolved of criminal responsibility. The court determined that she was aware of her actions and consequences, making her fully culpable under the law. Allitt was transferred to Rampton Secure Hospital, a high-security psychiatric facility where she is continuing to receive treatment for her diagnosis of fictitious disorder imposed on another, plus other mental health conditions. Section 41 is applied to the most dangerous of offenders like Allitt. Beverly cannot be released without the approval of the Ministry of Justice. She has lost the right to leave the hospital or transfer without government permission. And all these restrictions are applied to protect the public and to assure the careful management of someone like Allitt, who is extremely dangerous. At sentencing, Beverly Allitt received 13 life sentences, and this underscores the gravity of her crimes. I think this case highlights the finely balanced overlap between criminal law, mental health factors, and the systemic shortcomings in protecting vulnerable infants and children. The case of Beverly Allitt, or the so-called Angel of Death, remains one of the most terrifying examples of betrayal by a healthcare professional. Through a disturbing combination of manipulation, deception, and calculated cruelty, Allitt was able to exploit her position as a trusted nurse to harm the most vulnerable. What do you think about this case? Did the legal system appropriately handle it? And did we learn lessons from this case and implement solutions? Let me know your thoughts in the comments section below. And if you found this breakdown helpful, don't forget to like, share and subscribe for more deep dives into true crime cases where medicine and law collide. That's it for today. I'll see you in the next video. For now, take care.